Today, we're diving into a crucial topic that every man needs to pay attention to: health symptoms you should never ignore. Your body has a way of telling you when something's wrong, and ignoring these signs could lead to serious health issues. In this video, we'll be discussing 10 health symptoms that you should always take seriously. Each symptom could be a sign of a significant underlying issue, and it's essential to understand what your body is trying to tell you. So, let's get into the details and learn more about these symptoms. But before that, like and subscribe to our channel. 10. Unexplained weight loss. First up, we have unexplained weight loss. Losing weight without trying might sound like a dream come true for some, but it can actually be a warning sign of a serious health problem. If you're losing weight and haven't made any changes to your diet or exercise, unexplained weight loss can be associated with a variety of health issues. One common cause is diabetes. When your body can't properly use insulin, it starts to break down muscle and fat for energy, leading to weight loss. Other symptoms of diabetes include increased thirst, frequent urination, and fatigue. Thyroid problems can also lead to unexplained weight loss. Hyperthyroidism, where your thyroid gland is overactive, can speed up your metabolism and cause you to lose weight rapidly. Symptoms of hyperthyroidism include rapid heartbeat, nervousness, and sweating. 9. Persistent fatigue. Next on our list is persistent fatigue. We all feel tired from time to time, especially after a long day at work or a late night. However, if you're constantly exhausted, even after getting a full night's sleep, it could be a sign of an underlying health issue. One possible cause of persistent fatigue is anemia. Anemia occurs when you don't have enough red blood cells to carry oxygen to your body's tissues. This can make you feel weak and tired. Anemia can result from a lack of iron, vitamin B12, or folate, as well as chronic diseases like kidney disease. Sleep apnea is another condition that can cause chronic fatigue. Sleep apnea is a disorder where your breathing repeatedly stops and starts during sleep, preventing you from getting restful sleep. Symptoms include loud snoring, gasping for air during sleep, and waking up with a dry mouth or headache. 8. Chest pain. Chest pain is one of the most alarming symptoms you can experience, and for good reason. Never brush off chest pain, especially if it's accompanied by pressure, squeezing, or a feeling of fullness. These could be signs of a heart attack, which requires immediate medical attention. Heart attacks occur when the blood flow to a part of your heart is blocked for a long enough time that part of the heart muscle is damaged or dies. Symptoms of a heart attack include chest pain or discomfort, pain in the arm, back, neck, or jaw, shortness of breath, sweating, and nausea. 7. Shortness of breath. Shortness of breath that comes on suddenly or without a clear cause can signal a serious problem. It's essential to pay attention to this symptom, as it can indicate conditions like heart disease, asthma, or even a blood clot in the lungs. Heart disease, including heart failure, can cause shortness of breath because your heart isn't able to pump blood efficiently, leading to fluid buildup in the lungs. Other symptoms of heart failure include fatigue, swelling in the legs, and rapid or irregular heartbeat. Asthma is a chronic condition that causes the airways in the lungs to become inflamed and narrow, leading to difficulty breathing. Symptoms of asthma include shortness of breath, wheezing, coughing, and chest tightness. Asthma attacks can be triggered by allergens, exercise, cold air, or stress. 6. Changes in bowel habits. Changes in bowel habits, such as persistent diarrhea, constipation, or blood in the stool, shouldn't be ignored. These changes can indicate gastrointestinal issues like irritable bowel syndrome, IBS, Crohn's disease, or even colorectal cancer. Irritable bowel syndrome, IBS, is a common disorder that affects the large intestine. Symptoms of IBS include cramping, abdominal pain, bloating, gas, diarrhea, and constipation. While IBS is a chronic condition, it can be managed with diet, lifestyle changes, and medications. 5. Erectile dysfunction. Erectile dysfunction, ED, isn't just a bedroom issue. It can be an early warning sign of cardiovascular disease. ED can indicate problems with blood flow and vascular health, so don't be embarrassed to discuss it with your healthcare provider. ED occurs when there is insufficient blood flow to the penis to maintain an erection. This can be caused by atherosclerosis, where the arteries are clogged with fatty deposits. Atherosclerosis affects not only the arteries in the penis, but also those in the heart, leading to an increased risk of heart attack and stroke. 4. Persistent cough. A cough that lasts more than 3 weeks should be evaluated by a healthcare professional. Chronic coughing can be a sign of chronic bronchitis, asthma, gastroesophageal reflux disease, GERD, or even lung cancer. Chronic bronchitis is a type of chronic obstructive pulmonary disease, COPD, that causes inflammation of the bronchial tubes. Symptoms include a persistent cough that produces mucus, shortness of breath, and wheezing. Chronic bronchitis is often caused by smoking. Asthma, as mentioned earlier, can also cause a persistent cough. This cough is usually accompanied by wheezing and shortness of breath. Asthma is a chronic condition that can be managed with medications and lifestyle changes. 3. Frequent urination. Frequent urination, particularly if it's accompanied by increased thirst and hunger, can be a symptom of diabetes. It can also indicate issues with the prostate or bladder. If you find yourself running to the bathroom more often than usual, it's time for a medical evaluation. Diabetes causes frequent urination because high blood sugar levels lead to excess glucose in the urine, which draws more water from the body. This increased urine production causes you to urinate more often and become more thirsty. 2. Skin changes. Keep an eye on your skin for any new moles or changes to existing moles. Skin cancer, including melanoma, can often be caught early through self-examination. Look for asymmetry, irregular borders, color changes, diameter over 6 mm, or evolving features. Melanoma is the most serious type of skin cancer and can develop in an existing mole or appear as a new dark spot on the skin. The ABCDE rule helps you remember what to look for: asymmetry, border irregularity, color variation, diameter larger than 6 mm, and evolving size, shape, or color. Other types of skin cancer include basal cell carcinoma and squamous cell carcinoma. These are less aggressive than melanoma, but still require prompt treatment. Basal cell carcinoma often appears as a pearly or waxy bump, while squamous cell carcinoma may look like a firm red nodule or a flat lesion with a scaly surface. 1. Sudden vision changes. Sudden vision changes such as blurriness, double vision, or loss of vision can be alarming and may indicate serious conditions like a stroke, retinal detachment, or other eye diseases. Immediate medical attention is crucial for preserving your vision and overall health. A stroke occurs when the blood supply to part of your brain is interrupted or reduced, depriving brain tissue of oxygen and nutrients. Sudden vision changes, along with symptoms like numbness or weakness on one side of the body, confusion, difficulty speaking, and severe headache, require emergency medical care. Retinal detachment is a condition where the retina, the light-sensitive layer at the back of your eye, pulls away from its normal position. Symptoms include sudden flashes of light, a significant increase in floaters, and a curtain-like shadow over your field of vision. Retinal detachment is a medical emergency that can lead to permanent vision loss if not treated promptly. Thanks for watching, and if you found this video helpful, please give it a thumbs up, share it with your friends, and don't forget to subscribe to our channel for more health tips and information. Stay healthy and see you next time.